In this video, we're going to learn about the anatomy of the digestive system. Digestion begins in the mouth. From the mouth, food passes into the pharynx and then the esophagus. The esophagus is a muscular tube that connects the pharynx to the stomach, and it can be divided into three distinct parts based on its anatomical course. The cervical part begins at the level of the C6 vertebra, just below the cricoid cartilage, and extends down to the level of T1. The thoracic part, which continues from T1 down to T10. The abdominal part of the esophagus extending from T11 to T12. At its lower end, the lower esophageal sphincter prevents acid reflux from the stomach. The esophagus opens into the gaster, located in the left upper quadrant of the abdomen. The stomach has main regions: cardia, fundus, body, antrum and pylorus. Next, chyme enters the duodenum. The duodenum, which is the first portion of the small intestine, is divided into four distinct parts. The first part, also called the superior part, extends from the pylorus of the stomach and runs horizontally. The second part, known as the descending part, runs vertically along the right side of the vertebral column. It receives bile from the liver and gallbladder, and pancreatic enzymes for chemical digestion. The third part, or the horizontal, transverse, part, crosses the midline of the body, running from right to left, just in front of the aorta and inferior vena cava. The fourth part, called the ascending part, travels upward to the left of the aorta and joins the jejunum, supported by the ligament of Treitz. The jejunum is the middle portion of the small intestine, measuring about 2.5 meters in length. Vascularly, the jejunum is characterized by long, straight, and relatively few vasa recta arising from the superior mesenteric artery. The ileum is the final and longest portion of the small intestine, extending for about 3.5 meters from the jejunum to the ileocecal junction. Vascularly, it is supplied by shorter and more numerous vasa recta. The ileocecal junction, also known as the ileocecal valve or valvula Bahini, is the anatomical transition between the ileum and the cecum. These valves function as a one-way valve, regulating the flow of intestinal contents and preventing backflow of colonic contents. Clinically, the ileocecal junction is also an important landmark, as the appendix is located nearby. From the ileum, food residue passes into the large intestine, responsible mainly for water absorption and formation of feces. The large intestine includes cecum and appendix, ascending colon, transverse colon, descending colon, sigmoid colon, rectum and anal canal.
Traditionally, the liver is divided into right and left anatomical lobes by the falciform ligament. But for clinical practice, we rely on Cohenaude's segmentation, which is based on vascular and biliary supply. The liver has a dual blood supply: the hepatic artery, providing oxygenated blood; the portal vein, carrying nutrient-rich blood from the gastrointestinal tract. Blood leaves the liver through the hepatic veins, draining into the inferior vena cava. Cohenaude segmentation. Claude Cohenaude described the liver as divided into 8 independent functional segments. Segment 1. Caudate lobe, posterior, unique as it drains directly into the IVC. Segments 2 and 3. Left lateral section. Segment 4. Left medial section, subdivided into 4A, superior, and 4B, inferior. Segments 5 to 8. Make up the functional right liver, arranged clockwise from inferior anterior, which is 5th segment, to superior anterior, which is the 8th segment. This system is the foundation of hepatic surgery and transplantation.
The gallbladder is a pear-shaped organ located on the inferior surface of the liver. It consists of a fundus, a body, and a neck, which continues into the cystic duct. Bile produced in the liver drains from each segment into intrahepatic ducts that merge into the right and left hepatic ducts. These then join to form the common hepatic duct. From the gallbladder, bile exits through the cystic duct, which unites with the common hepatic duct to form the common bile duct. The common bile duct descends posterior to the first part of the duodenum and runs within the head of the pancreas. It typically joins the main pancreatic duct to open at the ampulla of Vater in the second part of the duodenum, regulated by the sphincter of Oddi. The pancreas itself has 4 parts: the head, the neck, the body, and the tail. The main duct system consists of the main pancreatic duct, duct of Wirsung, which runs through the length of the pancreas and usually joins the common bile duct to open into the duodenum at ampulla of Vater. A smaller accessory duct, the duct of Santorini, may also drain into the duodenum at the minor papilla.